Are you curious about liquid lipo? Well, let me break it down for you, just like it does to the fat in your body. Let's start out with, what is it? Liquid lipo is typically made out of deoxycholic acid. You might have heard of liquid lipo. One of the first FDA-approved brand medications to be used for this is Kybella, and that was approved around 2015. It's deoxycholic acid. So deoxycholic acid is actually made naturally in our bodies. It's made in our liver, and our liver sends it down into our intestines to break down fat that we ingest, kind of like dish soap that helps take away grease from plates. So it goes down into our intestines, breaks down the fat so that we can digest it. Well, it works very similarly when we inject it into stubborn areas of fat in our body. So we inject the deoxycholic acid into stubborn fat stores in our body, and basically it helps pop the fat cells like a little balloon, and then our body just absorbs those products. Once those fat cells are popped, they're killed, they're gone, they are no more, they are not coming back. But what a lot of people don't tell you is that the fat cells that remain, they can get bigger. Our adipocytes, which are our fat cells, can grow very large. And that is why even after surgical fat removal, such as liposuction, people can gain weight back because the fat cells that are left behind can grow. So, regardless of whether you're having surgical removal of this fat through liquid lipo or chemical removal of it, like through liquid lipo, also known as deoxycholic acid, or whether you're having body contouring, such as with Sculpt Neo or Cool Sculpting or our physique, like we have here in the office, you will still have to maintain your results. If you are not taking care of yourself through diet or exercise, you can gain that mass back, but just through the fat cells that remain after you remove or destroy the fat cells that were there. So, who is a candidate for liquid lipo? These are going to be individuals who are not extremely overweight. They just probably have stubborn areas of fat that they're wanting to get rid of, such as the submentum. Now, this is the area that back in 2015 that Kybella, which is deoxycholic acid, was approved for use. So injected Kybella or deoxycholic acid into this area reduces the submental fat pocket, which is genetic for a lot of people. So if someone is extremely overweight and has a lot of fat in the area, Kybella is not going to be the best treatment option. The best treatment option is going to be weight loss and probably surgical liposuction in that area. But same thing for the body. It's going to be little stubborn pockets of fat, maybe around the axilla. You could do it around the bra strap line if you have just a little stubborn area of pudge that you could see that hangs over your bra strap when you're wearing tight fitted clothing. You could do it little stubborn pockets of fat in the abdominal area, or even in the love handle area, inner thighs, the little banana roll underneath the glutes. So those are all great areas that can be treated with deoxycholic acid. The reason why liquid lipo is not the best option if you have a lot of weight to lose or a large amount of fat that you're wanting to address is because I can only safely inject you with a certain amount of liquid lipo at a time to avoid potential side effects. So typically treatment for liquid lipo or with deoxycholic acid entails you coming into the office, always having a consultation first so that the patient knows fully what to expect. We set those expectations for you. And sometimes it's a conversation where I am turning a patient down saying they're a better surgical candidate, or maybe we need to put them on a weight loss medication to help reduce the amount of fat before we attack stubborn little fat pockets. So consultation is always first. If you are selected as an ideal candidate for liquid lipo, then during that treatment, we cleanse off the area. We do put numbing over the site for about 15 to 30 minutes. And then typically we use a very small needle and we administer the product in small little serial punctures. Sometimes we will use a cannula, which is kind of like a longer needle with a blunt tip. And we're just gliding it through the fat pockets, administering the deoxycholic acid or the liquid lipo. Um, Again, treatment sessions are probably going to be about 3 to 5 treatments, 4 to 6 weeks apart. Swelling can happen, bruising can happen. Very rarely, inflammation around the nerve can happen, where there can be prolonged nerve pain or a temporary paralysis of sorts. This is mainly when we're injecting in the submentum or sometimes in the jowl fat pad. There is a nerve that runs close to the air. If you get too close or go too deep, there can be some complications there, but they're almost always temporary, but annoying nonetheless if they happen. But again, very rare. It's usually a very safe treatment with not a lot of downtime, and it's great for the right candidate. So if you have any further questions on liquid lipo or any of our other weight loss offerings or body contouring offerings, such as our GLP medications or our physique device, then please reach out to our office.